Hey everybody, my name is Chase, and we are in the month of June, which could only mean one thing: Pride Month. However, it's very hard to celebrate when our rights in the LGBT community are literally being threatened daily. So I'm mainly going to be talking about what's going on in the United States regarding trans rights, but it's really important, so please listen. So in the first 2 years of his presidency, Trump did not declare June as Pride Month, which, if we all remember, Obama, every single year that he was in office, literally declared June as Pride Month. And it was a celebration. Well, this year Trump decided to tweet about it. Instead of declaring it Pride Month or anything like that, he decided to tweet about it. And it left, I think, everybody really confused as to what's going on. As we celebrate LGBT Pride Month and recognize the outstanding contributions LGBT people have made to our great nation, let us also stand in solidarity with the many LGBT people who live in dozens of countries worldwide that punish, imprison, or even execute individuals on the basis of their sexual orientation. My administration has launched a global campaign to decriminalize homosexuality and invite all nations to join us in this effort. Exclamation point. I don't know about you, but I'm feeling really confused because this was 4 days after the Trump administration literally announced that they're going to be rolling back rights for trans people. So before getting into this topic in this video, last month I made a video about how the Trump administration is rolling back protections in relation to employment rights. So just to give you a small summary, so the Trump administration decided to change back the definition of what sex discrimination means. It now no longer includes gender identity, trans status, or sexual orientation. There are 3 cases right now that are going to the Supreme Court related to employment discrimination. And if the Supreme Court agrees with this, and honestly, look at the Supreme Court and who's on it and what decisions they've made recently, it doesn't look too good right now, which is really bad for trans people in the United States. So please make sure you take a look at that video. I'll put the link in the description below. Today, I'm talking about another huge proposed rule change regarding trans people and healthcare. Honestly, just saying this and talking about this, it makes me feel like crying. I was doing so much research about this and reading actual document files and government files, really trying to dissect every single, just to really understand what is going on. It is so overwhelming and it hurts so much to read some of these things, but I want to give you a brief summary as much as I can so that you know what's going on, because it is so important for us to know what's going on, especially during Pride Month. I don't want these things to go under the carpet and swept under the rug and people don't really know what's going on. We need to know what's going on. These new legislations and these new proposed rules are threatening our trans and non-binary family. We need to act up. So what's happening? Well, in 2018, it was suspected that the Trump administration would roll back some protections for trans people, especially related to healthcare. In April of 2019, it was becoming a real possibility that this rule was going to come into action. And now, last month, May 2019, it is official, it is on their website, they are now proposing this rule. And this doesn't look too good for us, but let me actually tell you what the proposed rule change is and how it's going to affect us. So the Trump administration is going to start removing protections for trans people under the Affordable Care Act. Affordable Care Act, also known as Obamacare. And it will also be okay to refuse to treat trans people under any circumstance based on your religious views. Let's unpack this and go into the first point. As I mentioned in my first video about employment rights, Obama was great for trans rights in terms of changing the definition of sex and adding gender identity, trans status, and sexual orientation to the definition of what sex discrimination means. However, now that Trump is in power, in 2017, the new Attorney General was like, we're gonna go back to that definition of what sex discrimination actually means, which means we're not including gender identity, trans status, or sexual orientation, which, going back to my video from last month, literally means that an employer can discriminate against you if you're trans. What year are we in right now? Seriously. So now the argument that's going on with healthcare is that in the Affordable Care Act, there is this thing called Section 1557. This section has been included in many discrimination acts: age, disability, and yes, employment. Here's a super simple way of thinking about it, all right? The definition of sex was changed in 2017. And because it was changed, now that they're looking at this new section, 1557, they're like, that definition of sex doesn't match the definition of sex that we have for this other act. So they're going back to the old definition of sex, which means that protection for trans people in healthcare will no longer exist. Now, keep in mind that this isn't all of healthcare, okay? It is government-funded doctors, clinics, healthcare providers, and insurance. I'm not going to go into this entire list of who's included and who's not included. However, I do want to zoom in on 2 aspects that millions of Americans rely on Medicare and Medicaid. These are government funded by the Health Care Financing Administration, which is a federal agency in the United States. If you're not aware of what Medicare and Medicaid are, they're insurance plans for people who are over 65, who are disabled, or who have a low income. And Medicaid also sometimes covers things that Medicare doesn't cover, like nursing homes. Let me throw out some numbers at you right now. 59.9 million people in the United States are on Medicare. 79 million people in the United States are on Medicaid. In total, 138.9 million people in the United States rely on these government-funded insurance policies. And of course, not all these people are trans, and of course, not all trans people are using Medicaid and Medicare. However, being trans already puts you at a disadvantage in society, especially if you are a trans woman of color. Therefore, this is going to affect the people who already struggle to find and access the care that they need. Second part of this is the religious aspect. So people in religious hospitals and who have religious views felt that they had to provide care to trans people. And when I say like you have to provide care and what kind of care I'm talking about, I literally mean that they thought that they would have to administer hormones and that they would have to perform surgery. This is ridiculous because first of all, if you don't know how to do it, don't do it. None of us want to go to a doctor that one, doesn't like us, and two, doesn't know what they're doing regarding to our health. However, as a doctor or a healthcare provider, don't you take some type of oath to like help somebody who is in need if you can help them? Like, let's say a trans person has an emergency, goes to the ER, when the attending or the nurse or the doctor is going to take a look at their chart and find out that they're trans, are you just going to say, nah, and run away? You're not going to save this person's life? I don't think so. That is beyond unethical, no matter what your religious beliefs are. And the thing is that trans people have said like countless times that the most discrimination they feel at the doctors isn't even related to being trans. And by that I mean like if you're going to a doctor and you're saying, I have an ear infection, and then they're like, let me see your genitals. So these healthcare providers are literally putting their religion in front of saving people's lives. No one is making you prescribe hormones. No one is making you perform surgeries that you don't know or want to do. The best thing that you could do is just refer out, right? Refer to somebody who might be able to do this instead of literally rejecting this patient. Honestly, it just boggles my mind. Like, how are we in 2019 and this is happening? Like, who cares if the person is trans? Help them. I don't know. Honestly, it boggles my mind that it is 2019 and this is happening. And maybe I'm making it bigger than it is, but I honestly want to make sure people know what's going on so that they know what to do and they know who to avoid. I know I sound a little bit dramatic right now, and even as I was writing this video, I was like, this sounds a little bit over the top. However, it's not, because here are all of the rollbacks that Trump has put into effect while he's been in office. In July 2017, Trump said that he wanted to reinstate the trans military ban. In January 2018, trans students lost their rights. In April 2019, the trans ban in the military went into effect. In May 2019, shelters can now refuse to accept trans people based on their religious views. May 2019, healthcare protection is at risk. And of course, the fate of employment discrimination is ongoing and happening right now. This isn't a joke. This is real, and this is happening. While I was reading the government files, I felt sick. Like, this is literally one of the sentences. It's not intended to put patients at risk, and that HHS does not condone discrimination. Are you kidding me? The definition of discrimination is exactly what is happening with all of these rollbacks. Rollback here, rollback there. I literally feel like every single month there's a new rollback for trans rights, trans discrimination. Something is happening. I feel like I'm at Walmart. The rollbacks are never ending. But these are rollbacks that we don't want. We want to keep protections. We fought so hard to have these protections, and now, in the blink of an eye, in a flick of a finger, they're gone. I know it's Pride Month and we're supposed to celebrate, but don't forget, Pride originated as a protest. Unfortunately, we need to keep fighting, even in 2019, even after all these rights were given to us and now they're being taken away. Now, my goal of this video was not to scare you. It is not to provide panic within this community. I think it's important for us to know what's going on because, for example, the shelter thing and trans people being discriminated against based on religious view, I didn't even know that. And I've been following the trans right thing forever, like almost every single day, and that kind of just swept under the rug. No one really talked about that. I think people call that like a paperclip legislation where they just kind of like add it somewhere so that like people don't really notice it, but it's there. So let's make sure this does not go unnoticed. This way we can stand up now and affect change before any of this actually starts to affect us. If you're wondering what you can do, you can always contact your representative. I'll put links in the description below on what you can do to help. Thank you for joining me for this video. Absolutely, it's Pride Month, all right? And we absolutely need to celebrate and we need to be here for each other. But let's also make sure that we are protected. Have a great day. Bye.